Let's revise concept of health and disease with me in 10 minutes. So there is changing concept of health, which are biomedical, ecological, psychosocial, and holistic. So biomedical describes health as absence of disease. Ecological describe करती है health को as equilibrium between man और उसकी environment में. साइकोसोशल बताता है कि हेल्थ इन्फ्लुएंस होती है बाय सोशल, साइकोलॉजिकल एंड कल्चरल इकोनॉमिक फैक्टर्स. होलिस्टिक इज कॉम्बिनेशन ऑफ ऑल ऑफ द अबव. नाउ हेल्थ इज मल्टी डायमेंशनल. फर्स्ट वन इज फिजिकल. फिजिकल का मतलब है परफेक्ट बॉडी फंक्शन. इफ दैट्स द केस देन यू आर हेल्दी. मेंटल डायमेंशन मीन्स balance between individual and himself. Then we have other dimension that is social, which means harmony within individual and between the individuals and others. We have a spiritual dimension also, which means finding the purpose of life. Other dimensions are emotional dimension, vocational and others. Emotional may is related to the feelings. Vocational is related to the work. Work plays a major role in health. It brings satisfaction and self-esteem. Other dimensions are philosophical, cultural, socio-economic, environmental, educational, nutrition. Then comes concept of well-being. Concept of well-being can be objective, it can be subjective. Objective can be measured by standard of living and level of living. Subjective, जो कि बहुत important है, is measured by quality of life, which is measured by PQLI and HDI. Physical Quality Life Index is PQLI and Human Development Index is HDI. Physical Quality of Life Index के 3 indicators होते हैं: life expectancy at 1 year, literacy rate and infant mortality rate. HDI के 3 dimensions होते हैं. First is life expectancy at birth, mean year and expected year of schooling, and the third one is gross national income. PQLI ranges from 0 to 100, HDI ranges from 0 to 1. Determinants of health include IFCS. I means individual, which means what are you born with, biological, gender, aging. Other determinants is family. That means where you live, that is which environment you live. Other determinants of health that are related to community are healthcare system, science and technology, and communication. Then comes the S, that is society. It includes determinants like human rights, equality, justice. We come to the concept of disease. Disease, which is objective and it's pathological. The clinician diagnosis. Then comes the illness, which is subjective, the feeling that is felt by the patient itself. Then comes the sickness, which is social. It is related to society's label and role. What are disease causation theories? So we have multiple theories. First is germ theory. Then comes the epidemiological triad, and that is agent, host and environment. Then comes the epidemiological triangle, which also includes the time, incubation period. There is multifactorial causation also given by Pettenkofer, and it says multiple exposures or risk factors lead to a disease. For example, non-communicable disease. There's one more theory, that is web of causation, which tells us about the complex intersecting relation between the risk where a specific agent is unknown. Breaking one thread or one risk factor, one chain, can alter the outcome. For example, myocardial infarction. Iceberg phenomena is followed by many diseases. The tip represents the symptomatic cases. Waterline represents the demarcation between apparent and inapparent cases. Submerged portion represents clinical carrier and undiagnosed cases. And it is not found in measles, rabies and tetanus. Disease follows a course that is known as natural history of disease. First comes the pre-pathogenesis phase, in which agent is present in environment ये अभी तक होस्ट में एंटर नहीं हुआ होता है। मेनली प्राइमरी प्रिवेंशन इसमें हम कर सकते हैं, डिजीज़ अभी होस्ट में हुई नहीं होती है। So mode of intervention we can do is, mode of intervention here is health promotion and specific protection. The next phase is pathogenesis phase, जहाँ पे एजेंट होस्ट में एंटर हो गया होता है। फर्स्ट कम इज अर्ली पैथोजेनेसिस फेज, जिसको हम सब क्लिनिकल केस भी बोलते हैं। द चेंजेस आर अकरिंग एट अ वेरी माइक्रोस्कोपिक और बायोलॉजिकल लेवल, नॉट येट विजिबल, नो सिम्टम्स आते हैं, नो साइंस आते हैं। सो इसमें हम अर्ली डायग्नोसिस एंड ट्रीटमेंट कर सकते हैं, दैट इज सेकेंडरी प्रिवेंशन वी कैन डू इन दिस। देन कम्स लेट पैथोजेनेसिस और क्लिनिकल फेज, इसमें वी कैन डू टर्शरी प्रिवेंशन। नाउ एजेंट्स क्या होते हैं? एजेंट्स आर लिविंग और नॉन लिविंग थिंग, देयर एब्सेंस एंड प्रेजेंस कैन इनिशिएट डिजीज, कैन बी बायोलॉजिकल, न्यूट्रिएंट, फिजिकल एंड केमिकल। होस्ट के डिटर्मिनेंट्स क्या होते हैं? There can be demographic and biological, and social determinants can also be there. Environment में हमारे पास physical, biological and psychosocial environment आता है. Psychosocial includes culture, mosquitoes and flies comes in biological, and air and water comes in physical. Time includes incubation period of a particular disease. Now comes most important topic, that is level of prevention, which includes primordial, primary, secondary and tertiary. Primordial में risk factor absent होता है. Mode of intervention is health education, school health education. In primary prevention, disease is not present but risk factor is present. It includes health promotion and specific protection as mode of intervention. Health promotion includes health education, environment, nutrition, and lifestyle. Specific protection includes immunization. Specific protection includes mass strategies and high risk group strategies. Example of specific protection is, for example, HIV screening among sex workers. This is a prospective screening as it is used on healthy population. In primary prevention, disease has started and it is in early pathogenesis phase. So prescriptive screening can be done, that is pap smear and self-breast examination. In tertiary prevention, the disease is already in late pathogenesis state. So we have to control the disability. Disability leads to impairment. Disease means abnormal condition. Impairment means loss of anatomical structure. Disability means inability to perform. Impairment means preventing the fulfillment of rule. डिजीज का एग्जाम्पल एक्सीडेंट है, इम्पेयरमेंट का फुट लॉस, डिसेबिलिटी का कांट वॉक एंड impairment means handicap. Another part of tertiary prevention is rehabilitation, which is combined coordinated use of medical, vocational, social, educational measures for training and retraining to achieve the highest possible functional ability. इसके कई टाइप्स हैं, जैसे कि मेडिकल, वोकेशनल, सोशल एंड साइकोलॉजिकल. मेडिकल मीन्स फंक्शनल रेस्टोरेशन, vocational means earning livelihood, social means restoring the social relations, and psychological is related to dignity. Quaternary prevention is related to overdiagnosis of disease. Okay, what does disease control means? It means reducing the disease to an acceptable level. Elimination means interruption of transmission in a defined geographical area. Its examples are polio, measles. Eradication means absolute termination of all disease transmission by exterminating the disease agent. Examples are smallpox and dracunculiasis. For controlling the disease, we have to do monitoring and surveillance. Monitoring means continuous oversight of activities, and surveillance means continuous scrutiny of factors. मॉनिटरिंग इज डन बाय टेक्नीशियंस एंड सर्वेलेंस बाय प्रोफेशनल. मॉनिटरिंग का एग्जाम्पल है मॉनिटरिंग वाटर पॉल्यूशन, एंड सर्वेलेंस का एग्जाम्पल है एपिडेमियोलॉजिकल सर्वेलेंस. सर्वेलेंस इज ऑफ 3 टाइप्स: एक्टिव, पैसिव एंड सेंटिनल. इन एक्टिव सर्वेलेंस, health worker or a doctor actively find the cases by going door to door. Passive surveillance में patient itself reports to the hospital. Sentinel surveillance is the study of disease rates in a specific population and deriving that rates to estimate the trends in general population. Done in NACP. Health indicators should be valid, reliable, relevant, sensitive, and specific, and feasible. Mnemonic can be VR to S2F. Health indicators are mortality, morbidity, disability, nutritional, utilization, healthcare delivery, and social and mental, socioeconomic, environmental, health policy, and quality of life. Mortality includes crude death rate, neonatal mortality rate, IMR and MMR. Morbidity, incidence and prevalence को include करती है. Disability includes various indicators like disability adjusted life year. It includes years of life lived with disability and years of life lost. It is the sum of both. It measures burden of disease. QALY is another indicator which shows the quality of life expectancy gained because of an intervention. It tells us about the effectiveness of intervention. Another indicator is health adjusted life expectancy, which means years of life spent in a good health. It's a positive indicator. We have Sullivan Index, which is life expectancy minus disability adjusted life years. International Classification of Disease 11 came in 2022. It has 27 chapters, 26 chapter plus chapter X. It has Arabic chapters, and new chapters are immunological disorders, blood disorders, sexual health, sleep, and traditional medicine. It is browser based. We'll discuss about community diagnosis, which means identification, quantification of health problems in a community, which is based on age, sex, vital statistics, and incidence and prevalence.